welcome to a new episode of Academic Chat, your series dedicated to exploring academic topics and concepts related to the disciplines taught at Faculty of Governance, Economics, and Social Sciences. Today we focus on how populations react to public policies, why some measures are accepted while others trigger resistance. The COVID-19 pandemic offers a powerful case to explore these dynamics as governments introduced unprecedented restrictions on everyday life. To help us unpack these questions, we are delighted to host Professor Amir Abdul Reda, but before, let's hear from our students at UM6P Rabat campus on today's topic, crisis policies and public reactions, lessons from the COVID-19 and beyond. We'll be back afterwards.
During the COVID-19 crisis, people initially accepted strict measures because of fear and uncertainty. But over time, when rules seemed inconsistent or poorly explained, and especially when economic support was limited, people became frustrated and more resistant. People also compared policies across countries or regions, which sometimes made restrictions feel unfair. That loss of trust really fueled opposition.
Policy responses during crisis isn't only about acting fast, it's also about acting clearly and supporting the people. Honest communication, good timing, and economic or social work can make a big difference. But without them, even well-intended measures can face strong resistance.
Thank you to our students for these insightful comments that will allow us to open the discussion with our guest speaker for today's episode, Professor Amir Abdul Reda. Professor, hello and thank you for being with us today.
Hello Norman, thanks for having me again. Very happy to be here.
It's always a pleasure. Professor Amir, the COVID-19 pandemic confronted governments with unprecedented challenges, requiring them, of course, to introduce extensive restrictions on everyday life. Why were some measures broadly accepted while others triggered significant resistance or protests?
That's a very good question. So maybe let me give you a bit of a general perspective on how we started the project and how this leads us even to answering the question. So COVID-19 was one of these crises that really hit us at a time where our capacity to collect data and to, let's say, share it with others was really well developed. And as we were encountering the pandemic, lots of people really took advantage of this in order to design studies that try to assess whether or not those policies that were implemented were working. And the main leitmotif, the main reason for this is pretty straightforward. It's that lots of people argued in the public sphere, whether on social media, on talk shows, in protests for what it's worth, that those policies were just not only very stifling for liberties, they were very annoying for people, having to stay at home, having to wear masks, having to take the vaccine when it came up, even though these people were not necessarily people that wanted to do these things on a day-to-day. There were already some debates about vaccines in some strands of society. And there were a lot of back and forth at first, if you remember, with mask mandates. At once saying you should wear a mask and then you should not wear a mask. So it was very contradictory. And so people were like not sure about these policies, at least coming from the public sphere. And so several papers came out already at the beginning of throughout the pandemic, trying to assess, were these policies working? Were they working at keeping people at home? What were their impact on protests? And why were they leading to protests in some cases and not in others? And the idea of protest as an outcome is very natural here because that's the most evident way in which people are just saying no to these policies. The other way to measure whether or not they're not complying with the policies is mobility data, but mobility data like from Google is not necessarily as representative because it depends on a number of features that people don't turn on their phones, and once again because they want to have privacy. And so protests were a natural way to look at this. And to go back to your question, which was, remind me if I forgot it, why do some people respect them and not?
Exactly.
So the main reasons we found were twofold. The first one was the severity of the policies. So throughout the pandemic, if the policies are too high, obviously people are going to be a bit, let's say, annoyed by this. That being said, when you take the whole timeline of the pandemic, there isn't necessarily a linear relationship between policy severity and the occurrence of protests. And that's because of a natural reason, which is that as the policies become very stringent, they become very severe, people are kind of stuck at home. It's very hard to go and protest when you have like some kind of a maximalist policy context, a maximalist severity context, a context in which there's stay-at-home mandates, no-fly zones to a certain extent. No-fly zone exaggeration, but you get the point. Mask mandates, you have to do the vaccine, you have like curfews. It's hard to go and protest in this context. And so what we found is that it depends on social policy. So what does the state do to alleviate the economic and social pain on people? Is it giving economic support to these people, which is like mortgage alleviations, alleviation on taxes, alleviation on let's say, cash transfers, giving people cash transfers so they have the means to survive while they're not working and not necessarily getting a wage, so to say. These things mattered a great lot, right? So when there were no such economic support and stringency of the policies increased, then people went and protested more because they felt it was unfair. Right? They were like, well, you're keeping us at home. We cannot do anything. We can see maybe in the media, whatever we see in the media, that things are okay, or immediate friends and families don't seem to suffer so much. And that goes back to the whole idea of people not having necessarily a bird's eye view of society. They have a view of their surroundings, immediate surroundings, you see. So that in and of itself was the main reason. And the reverse obviously was true when the policies of economic support were there. People tended to stay at home because there is no necessity to go out. There's no necessity for them to go and expose themselves to the risk of the pandemic.
Yes. Well, beyond the level of restriction itself, how important were factors such as the timing of interventions, the way policies were communicated, and the presence of economic or social support in shaping citizens' responses?
That's a very good question. The first two things we haven't tested as much. So the timing of the policies and the communication of the policies are something we haven't so much so tested. With communication, it's a bit of an obvious way to look at it, but we just didn't have the data. People could look at the kind of framing that the politicians gave, the back and forth in communication, but that's just data that is not as evidently out there, and you have to really go and collect. What we did was we went with convenience in many ways, and we looked at the thing that people looked at the most, which was also the most straightforward answer, which is the economic answer, which was compiled already in data sets. And so all we had to do was match it with protest data. The other thing, the question of timing. Timing is a bit more complicated because then it's timing in relation to what? You see, if it's timing in relation to an election cycle, then it's a bit more evident. But then there's also the question of why does timing matter, you see? And we didn't see something as strong there to test as much as we saw something that was more evident with economic support, which is the material answer is usually the right answer in our world.
We also observed considerable cross-country differences during the pandemic, both in terms of compliance and contestation. What do you see, Professor, as the main drivers behind these variations across different contexts?
So cross-country differences during the pandemic are something notable, especially since some countries had severe waves, serious waves of COVID-19 infections, and others didn't have so much. On one hand. On the second hand, there's also the fact that some countries really implemented very particular policies from the get-go. If you remember, countries like Sweden, if I remember, were like, we're not going to do anything we're just going to let it happen, while others from the beginning started implementing very strong policies. And what we do here is we look across Europe, really. We don't look in this test at particular countries, although I'm sure that, you know, for country-specific things, the same logic can be implemented. The idea of statistical tests is that you look on average across the region, something representative for the region. But naturally, if someone is not doing policymaking for Europe or policymaking for a regional ensemble like North Africa, you want to look within the country itself. Like interested policymakers can look at studies like this and say, well, you know, these are things that are interesting, but let me test it for my country in particular to have a better sense of how I can implement this for my country.
Professor Abdul Reda, I got one last question for you. And looking ahead, what are the key lessons that policymakers should draw from the COVID-19 experience to design crisis responses that are not only effective, but also socially acceptable and sustainable?
So that's a very good question, and that's kind of the question that we try to address here. As I mentioned, when we wrote the paper, there was already several studies that were up there, but they didn't look at the whole timeline of the pandemic, you see. And so what we considered there was that there could be an issue with what is called selection bias, because in that context you close a time series, you end the time series of your data before the event is completely done. And in the context of a pandemic, we know when it starts, we know when it ends. And so we were like, well, let's look at this again. And we did find different results compared to some other people, which were that, for instance, economic support matters much more than most people realize at the time. And so my answer to policymakers here is the fact that, well, as you implement these severity policies, you have to have something that you put in for the people that materially alleviates the pain. One important question that is left from our study, and which we consider doing for as a future study, is what do you do in contexts where you cannot necessarily give material support, like in most African countries, where states don't necessarily have the means to, you know, give money to people as freely. And that's an open question, really. That's very much of an open question, and that's something that future studies should definitely look at. That being said, policies in Africa were not necessarily as severe as in Europe, and so that's also something a bit telling. And by the time another pandemic happens, most likely things would have evolved for African countries to the extent that the question doesn't really become relevant. Because if you remember, what people told us back in the days, and were still telling us, is that pandemics happen generally in a cyclical pattern every 100 years. And so by then, do the context that we have today, do the limitations that we have today become or remain relevant limitations for the future? Maybe not. Let's hope so, at least. And the other thing, which is the most obvious thing, at least from the popular consensus that we didn't test this, is a contradictory messaging. You should really make sure that you understand what you're telling the people so that you don't go back and forth. The back and forth creates a bit of a, it seems to create, we haven't tested this and nobody seems to, at least from our research, it seems to create backlash. It seems to create the situation in which people say, well, there is misinformation, we're being lied to, it's fake, the deep state. You see what I mean? Although that's something that is worth really looking further into. So, pretty much.
Well, that's it for today. We've come to the end of today's episode. Professor Amir Abdul Reda, thank you once again for being with us today and for sharing with us and with our audience some key insights on today's topic, crisis policies and public reactions, lessons from the COVID-19 and beyond. And we hope to have you with us again very soon.
Thank you so much, Norman. Have a good one.
Thank you to our audience for joining us. You can learn more about our upcoming activities and programs by visiting our website on www.fgsesum6p.ma. We shall meet again very soon. Until then, stay connected and keep seeking knowledge.